Hello friends, welcome to Dezinlife. Friends, very often we conclude that trainings in pharma sales and marketing are not effective, or you can say they are not so productive. Many top leaders or even promoter confess this fact quite often. However, despite all that, almost every company spend time and money on the training, and again they conclude it was not effective or it has not increased the sale, and the cycle goes on. So today we will dissect this problem, why trainings are not so effective in the pharma sales and marketing, and in spite of that, why we keep on organizing trainings. So first I'll give you 5 different reasons why trainings are not so effective or not so productive in pharma sales and sales and marketing. And then I'll give you reasons why, in spite of that being not effective or in spite of being not productive, why we keep on doing it. So reason number 1. See, training manager job is to teach a skill to do that job better. If he's training to the area manager, regional manager, general manager or medical rep, whatever they are training, their job is to teach them so that they can do this job better. However, in most of the cases, the training manager in the pharma industry are having working experience of working maximum up to area manager, some cases product manager, some cases may have to regional manager, but beyond that, I don't think even 5% are there who has working experience beyond regional manager or beyond product manager. So these training managers can impart only soft skill training. They can't impart the job skill because they themselves have not done or not worked up to that level, or they were not so oriented per se. I'm not saying because if somebody has not done the job, he cannot teach. They can teach, but that kind of orientation, that kind of confidence which they require to training or teaching the job skill is lacked than there in those cases, as good as 95% of cases. And then they do training with age-old templates, age-old slides, which does not address the issue of the today. Because this template kind of things or this module, they may be made maybe 10 years back or 15 years back or 20 years back, and they are carrying it, maybe with some addition, deletion, all that. So more focus remain on having good set of slides, maybe good animation, good pictures, and doing some new and different and good activities, but instead of addressing the core issue. So that make a reason number 1 why it does not succeed much. Reason number 2. In the pharma sales and marketing, most of the cases, the trainings are not customized. And if trainings are not customized, it means that does not address the problem of this particular company. If training is becoming a very routine, one training slide is being used for different companies who has different set of the problem. So how this training is going to be productive for the different companies when different companies face the different kind of issues? So obviously, this kind of training will not be so successful, will not be so productive because they are not customized. If we really want to train, we need to be customized training. Reason number 3. The business problem of the many of the companies are primarily due to business strategy of the company, or we can say marketing strategy of the company. And if these two are not on the place, or if these two are not correct, then training manager has very little to do or very little to offer. He or she can't do much. And sometimes, in some cases, the people management also play the big role in the business issue of the company. If the people management in the company is not on the place, or there is something issues are there, then trainings will not be productive enough, whatever we do, because the problem remain and we have not addressed the problem. So trainings cannot be done in isolation from the business or in isolation of the business strategy or the marketing strategy. Reason number 4, friends. Training manager in most of the cases are not aligned with the business strategy or with the business side. In many of the cases, they do not report to the business side of the company, they report to the HR. This means training strategy and the business strategies are in two different worlds, where HR is conducting training and business head is doing the business. And many of the company, they does not in the good relationship also. They operate in different silos, and which are the fault finding mode. where training people says we are giving training but implementation not good, or people are not learning, or manager, online manager is or not following up, and business people may says the training is not effective enough, and they very quick to conclude that. So you can't expect ROI from these kind of trainings. Now coming to fifth point, friends, in most cases training managers' objective are not about increasing sale. In fact, that does not include in their KRAs also. The KRA, or they basically look at number of training program they have conducted in a year, number of training hours they have conducted, or number of people they have trained in a year, or kind of different program they have developed, and so on. So most of the stuff are there in KRA, or most of the stuff they are focused at are of more of resume building stuff, not actually sales increasing stuff, or say marketing improving stuff. So these are the 5 different reasons why trainings are not so effective, or why trainings in the pharma sales and marketing does not give the productive result much, or does not come to our expectation. To speak all this tough, it's a tough for training managers or training people. But if we do not speak or do not listen tough, I think things are not going to change. Now I come to why, in spite of that, we keep on continuing with the same training module or same set of the system, and we does not correct. See, promoters or the top leaders, they says regarding training, I know it will not deliver, but let's try this also, so that people don't say later that I was not given the training. So they, instead of looking at their business strategy, or you can say instead of relooking that business strategy, or instead of relooking their own way of working, they look at whom to blame. So they know that it is not going to work, but despite that they do it because people should not say later that I was not trained enough. Some leader says this gives the feel good factor, and some manager says use it just to pass the blame on the people, to justify that I am doing everything possible to success and I am training the people also. And lastly, some leader, they simply do it. It's a kind of attempt, or can say knowingly attempt, to prove that people are bad. I am right, I have the right strategy, because people are not implementing, that is one failure. And even for implementation or even for improving their skill, I am giving training also, but even then they are not producing result. It's a people are bad. I think people need to be replaced, and then ball goes back to the HR. So friends, if something starts with this kind of intention, how come you expect a positive return or positive result when something we are starting with the negative intentions only? So this was the issue, and I know this issue little hard hitting, or you can say something very hard to, it looks like exposing something. But if we have to improve things, I think we need to do it. I hope this will make my friends to think over this, and wherever feel like if we can correct something, so it's good for the pharma sales and marketing, it's good for training manager, and good for business strategist also, and good for business heads also. We need to really look at the issues instead of intention to tarnish, or you can say put or pass blame to somebody else. Thank you very much for friends watching for us. Thank you.